If a person has the flu and experiences tiredness and weakness, it's easily explained because most people feel fatigue during the flu. However, when a person has a constant sense of tiredness that doesn't improve with rest, and the cause is unidentifiable, it is termed chronic fatigue syndrome. This condition is diagnosed when it lasts more than 6 months, and the tiredness and fatigue are so severe that they interfere with performing daily life activities. The first and most common cause of chronic fatigue syndrome is the post-viral period. Many viruses, including very common ones like the flu virus and COVID-19, can cause fatigue syndrome even after the recovery period, which can last for months. Not only common viruses, but many rare viruses also cause chronic fatigue, such as Q fever, West Nile fever, parvovirus, and many others. The second most common cause of chronic fatigue syndrome is a weak immune system. If the immune system is not competent enough, the body constantly fights infections, meaning the immune system is always in an activation regimen. This increases inflammatory cytokines, which can cause a sense of fatigue in the brain. Thus, there is a high probability of increased inflammation levels in the body when chronic fatigue syndrome is due to a weakened immune system. The third most common cause is mental health issues, such as depression, anxiety, and stress. Poor sleep quality also plays an important role. These issues cause changes in neurotransmitters and hormonal imbalances in the brain, which we perceive as chronic fatigue. For example, during depression, there is a low level of serotonin and dopamine, which are responsible for mood, motivation, and energy levels. Sleep deprivation increases stress hormone levels, promoting chronic inflammation in the body and decreasing growth hormone levels, which are produced during nighttime in the deep sleep stage and promote tissue regeneration and repair. The fourth most common cause of chronic fatigue syndrome is hormonal imbalance. People with chronic fatigue often have abnormal stress hormone levels, known as cortisol, which can be elevated or decreased. Additionally, many patients with chronic fatigue syndrome have a deficiency of dehydroepiandrosterone, DHEA, a precursor to the male sex hormone testosterone. In some cases, low DHEA or growth hormone deficiency causes chronic fatigue syndrome, as growth hormone is responsible for tissue repair and regeneration. These hormonal imbalances can develop due to chronic stress, infections, impaired immune system function, or genetic factors. The fifth most common cause is genetic predisposition. If a person's first-degree relatives have chronic fatigue syndrome, then there is an increased risk of the condition. The sixth most common cause is physical or emotional trauma. Overactivity or a passive lifestyle both can cause chronic fatigue. The seventh most common cause is nutritional deficiencies, especially vitamin D and vitamin B12 deficiencies, which cause chronic fatigue. Treatment of chronic fatigue syndrome first involves treating the underlying condition if it can be determined. Before medications, priority is given to gradually increasing the intensity of exercises. Cognitive behavioral therapy is also used to identify malfunctioning thoughts and replace them with healthy ones. For example, the thought "I will never get better" can be replaced with "I'm working on my fatigue," and small steps make a difference. To improve sleep quality, low-dose antidepressants such as amitriptyline, antihistamines, melatonin, or valerian roots may be used. If a person has hormonal imbalance or depression, antidepressants like fluoxetine, Prozac, and sertraline, Zoloft, are often used, and the duration of medication can range from weeks to months before being gradually stopped. Stimulants like modafinil, Provigil, and methylphenidate, Ritalin, are used cautiously due to potential side effects and dependency risks. Supplements commonly used for chronic fatigue include vitamin B complex, vitamin D, magnesium, and omega-3 fatty acids, as they play crucial roles in energy production, nervous system function, and reducing inflammation. Probiotics, especially lactobacillus species, can improve immune system function and reduce inflammation. Less studied but commonly used supplements include coenzyme Q10, CoQ10, which is an antioxidant important for energy production, L-carnitine, which helps transport fatty acids into mitochondria for energy production, and D-ribose, which is involved in the synthesis of ATP, the energy currency of the cell. Adaptogens like ashwagandha and ginseng may also play a role in energy production.